Welcome to my channel Medicine Guide. Please subscribe to my channel Medicine Guide. What are uses and side effects of metronidazole? So first we will see which class of drug metronidazole belong to. Metronidazole is one of the mainstay drugs for the treatment of anaerobic bacterial infections, protozoal infections, and microaerophilic bacterial infections. It is cytotoxic to facultative anaerobic microorganisms. Metronidazole is FDA-approved for treating protozoal infections such as Trichomoniasis vaginalis, Entamoeba histolytica, Giardia, lamblia, blastocysts, and Balantidium coli. It is also FDA-approved to treat anaerobic bacterial infections caused by Bacteroides species, Fusobacterium species, Clostridium species, Gardnerella vaginalis, Helicobacter pylori, Prevotella species, Porphyromonas species, and Biophilia Wadsworth. Therefore, it is not surprising that metronidazole is widely accepted and FDA-approved for the treatment of a broad range of infections like intestinal amoebiasis, liver amoebiasis, bacterial septicemia, bone and joint infections, central nervous system infections like meningitis and brain abscess, and other infections like endocarditis, gynecologic infections in which endometritis, tubo-ovarian abscess, bacterial vaginosis, and in other infections, intra-abdominal infections, lower respiratory tract infections, skin structure infections, and surgical prophylaxis like colorectal surgeries. Mechanism of action. Metronidazole diffuses into the organisms, inhibits protein synthesis by interacting with DNA, and causes a loss of helical DNA structure and strand breakage. Therefore, it causes cell death in susceptible organisms. The mechanism of action of metronidazole occurs through a four-step process. Step 1 is the entry into the organism by diffusion across the cell membranes of anaerobic and aerobic pathogens. However, antimicrobial effects are limited to anaerobes. Step 2 involves reductive activation by intracellular transport proteins by altering the chemical structure of pyruvate ferredoxin oxidoreductase. The reduction of metronidazole creates a concentration gradient in the cell that drives uptake of more drugs and promotes free radical formation that is cytotoxic. Step 3 Interactions with intracellular targets is achieved by cytotoxic particles interacting with host cell DNA, resulting in DNA strand breakage and fatal destabilization of the DNA helix. Step 4 is the breakdown of cytotoxic products. Metronidazole is also cytotoxic to facultatively anaerobic bacteria like Helicobacter pylori and Gardnerella vaginalis, but the mechanism of action to these pathogens is not well understood. Adverse effects or side effects. The primary adverse effects of metronidazole includes confusion, peripheral neuropathy, metallic taste, nausea, vomiting, and diarrhea. Adverse events seen in greater than 10% of the population include headache 18%, vaginitis 15%, nausea 10% to 12%. Adverse events affecting less than 10% of the population are metallic taste 9%, dizziness 4%, genital pruritus 5%, abdominal pain 4%, diarrhea 4%, xerostomia 2%, dysmenorrhea 3%, urine abnormality 3%, urinary tract infection 2%, bacterial infection 7%, candidiasis 3%, flu-like symptoms 6%, upper respiratory tract infection 4%, pharyngitis 3%, and sinusitis 3%. Rarely there are reports of transient leukopenia and neutropenia as well. Metronidazole comes with a black box warning that it may be carcinogenic based on some animal studies in mice and rats. However, the risks are considered low, and additional follow-up studies of patients treated do not reveal an increased cancer incidence. As with any medication choice, physicians and patients must decide whether the benefit from therapy outweighs the potential risk. The use of metronidazole should be reserved for conditions approved by the FDA. It should not be used prophylactically or unnecessarily. Additional warnings and precautions for metronidazole exist. Prolonged drug courses can cause severe neurological disturbances due to the risk of cumulative neurotoxicity. Monitor for neurologic sequelae and discontinue therapy if any abnormal neurologic symptoms occur. Prolonged use may also result in fungal or bacterial superinfections, including C. difficile associated diarrhea (CDAD) and pseudomembranous colitis. There are reports of CDAD even after more than 2 months of post-antibiotic treatment. Candidiasis infection may also be more prominent during metronidazole treatment. Disclaimer: Channel's intention is to make sure that its consumers get information that is accurate, reviewed by an expert, and error-free. However, the information mentioned here should not be used as a replacement of the advice of a qualified physician. The information given here is for informational purposes only. Thank you for watching the video. Please subscribe to my channel, Medicine Guide. Please subscribe to my channel, Medicine